It's expected to be rolled out within a week. How do you feel about the vaccine news? Do you have any questions about it? If you do, then we've got experts to answer them after 9 o'clock. Will you be next in line to take it? What impact will it have on you? So 08085 909 693. If there's anything you want to put to our experts, or you can tweet us at BBC 5 Live, or as always, the text number is 85058. Dr. Bharat Pankhania is a senior clinical lecturer at the University of Exeter Medical School. Good morning, Dr. Pankhania.
Hello, good morning, everyone. Good morning.
In the medical world, this must be a great day.
It is a very good day for humanity the world over. We've now got a third vaccine in record time against the SARS-CoV-2 virus, and that's a really good day for humanity.
It's the second one to be approved in the UK. It's expected to be rolled out within a week. How important is it that it's rolled out quickly and en masse?
Oh, it's extremely important. Yesterday, we saw over 50,000 new cases in the UK of SARS-CoV-2 infection. That is a huge number. And the only thing we can do is immunize at great pace to protect our population and protect them long term.
The UK has 100 million doses. Is that enough to make a difference and make an impact?
Yes, it will. So 100 million equates to 2 doses. That's 50 million protected. So we've still got a few more than 100 million to be needed in the totality of the things. But what is really urgent is we don't immunize 1 million a week, but we double it to 2 million a week if we are to get a better 2021 sooner.
But presumably the vaccine is here to protect people going forward, but there are people who are fighting the virus now. What would you say to people who are perhaps thinking, oh, great news, we've got a vaccine, this is all over? Is it over yet?
No, not at all. And we mustn't drop our guard. We've had a tough 12 months. And at the last 11th hour, why drop your guard? Until and unless you are fully protected and we know how the vaccine is performing, we keep our guard up from infection control. We keep a low profile amongst human beings and continue as we are. We know that this is good news, but we do not drop our guard. This is very important.
Let me bring in Nicola in Sheffield. Good morning, Nicola. I believe that Nicola is a director of a care home. You've got a question for Dr. Pankhania, haven't you? Oh, Nicola doesn't appear to be there anymore. Nicola is the director of a care home, Dr. Pankhania. She wanted to know how quickly will the vaccine be rolled out to care homes and who will be in charge of the rollout? Obviously, lots of very vulnerable people, top of the priority list in care homes.
So the good news about the AstraZeneca-Oxford vaccine is that it can be stored at 3 to 8 degrees centigrade. In other words, the standard fridges that we have in GP practices. And also it can be transported easily. And therefore, I expect to see GPs taking the lead in giving these vaccines. The MHRA, the Medicines Healthcare Regulatory Authority, will be giving a good breakdown of the sequence of people who are going to be immunized. This will come later today. But I visualize that it will be delivered in Nicola's case by her primary care team, and they will come and probably do it at the care home. And it will be a high priority, but we just have to wait for what the MHRA say about the rollout and who gets it first.
Nicola's with us now. Does that answer your question, Nicola?
Obviously, we welcome the vaccine. It's just that we were promised this, almost a month ago, really, that we were obviously the high-risk group. So it's just, we need reassurance for our staff and our residents on a timescale on when we will get the vaccine, because we know we're a high-risk group, and it's really important that we get our staff and our residents vaccinated as soon as possible.
Have you had any communication about the Pfizer vaccine and when and if it might be administered to your residents?
No, none whatsoever. And that's incredibly frustrating because we were under pressure to obviously get staff on board and residents and their families to immunise everybody, which we did many weeks ago. And then we've not heard anything since. And I know locally, other homes have not had no communication whatsoever, which, it does feel a little bit like, care homes have been pushed to one side in certain parts of the country. And, I am aware that other homes in other areas have had the vaccine, whereas Sheffield, we haven't. And again, it's down to demographics and how and when do we get that? Because how have they ascertained the facts on who gets the vaccine and when, really? So I think it's great to hear this, but it's in reality, when will we get it? That's the question that I've got.
And obviously, without knowing the full details, we don't know why you haven't had it yet. It could be down to the logistics and what's involved in rolling out that Pfizer vaccine, which needs the high temperature. But now that the AstraZeneca vaccine has been approved and it can be stored at a lower temperature, is that something that you will be chasing instead, perhaps?
Yeah, I think it really is a case of we will have whatever we can get our hands on. Ultimately, I think that's where we are today. Is whatever vaccine we can get, we will obviously welcome with open arms. And if it's easier logistically to store it at different temperatures, and it's easy to roll out into care homes, we'd absolutely welcome that. It's just, in reality, when will that happen? That's the question that I've got.
Any reassurance you can offer, Dr. Pankania?
Well, as I have said, the AstraZeneca-Oxford vaccine is considerably easier to store and give at pace. And all I can say is I hope that we set up a super massive immunization program to immunize, as described, the vulnerable people, the healthcare workers who are in the front line, and all the other people at the same time as well. Just hold your horses. At least we've got approval of a easy to give vaccine, and things should start getting clearer by the day.
Keep the faith, Nicola. That's Nicola at a care home in Sheffield. Let's bring in Paul in Cambridge. What's your question, Paul?
Oh, hi there. So actually my question is, we've obviously seen high levels of infections and high levels of number of people dying in hospital, unfortunately. Will this new vaccine, will it be able to help people already in hospital beds? Will it make any difference to them either surviving or dying?
Yes, so it's very unfortunate to have so many people ill with the infection. So the vaccine is created to help people have immunity against the virus. It hasn't been created to treat people who've already got the infection. So I'm sorry to say, people who've already got the illness, are ill in hospital with the infection, will not benefit from having a immunization care of the AstraZeneca-Oxford group vaccine, or any other vaccine for that matter.
But obviously, in terms of what we know about people fighting the virus, has come on leaps and bounds since the start of the year, hasn't it?
Oh, indeed it has. And we've got better at managing patients in the hospital, and therefore our deaths from SARS-CoV-2 infections have come down. And as well, we've got a few armaments for medications also appearing to work. We know that in severe cases, dexamethasone is a help. And there are people working on research on monoclonal antibodies as well, in case they also help. So there are things that are there in the therapeutics armaments. Unfortunately, vaccines don't help by the time you've been infected.
Thank you very much for your call, Paul in Cambridge. 08085 909 693. If there's anything you want to ask about the new vaccine or share your experience, which is what Josh in Birmingham has done. Thank you, Josh. You've been waiting patiently in the wings there. You're a research paramedic and you've had one of the jabs, haven't you?
That's right. So I'm a research paramedic. It's my day job for West Midlands Ambulance Service, and I took part in the Oxford trial. I had my first jab on the 12th of June, so quite some time ago now. Didn't know what I'd had for the last 6 months, and then I was unblinded earlier in December, and it turns out that I did have the vaccine itself. So I'm really pleased to hear this news today.
Any side effects or did you feel ill at all after having it?
No, not at all. So I tweeted about this at the time. I didn't know whether I'd had either the COVID vaccine or a meningitis jab, but I said that I had a slightly sore arm, but otherwise nothing.
obviously in June when you had the vaccine, that was relatively early on in this pandemic. Did you have any nerves at all about putting your hand up to have it?
No. So what happened was I had an antibody test through work, tested negative for antibodies, and a researcher colleague of mine said, "Oh, well, then you're eligible to take part in this trial." I'm lucky to be in good health, and that's a privilege really to be able to take part in the vaccine study to help other people who are not so fortunate.
Was there an element of that? Did you feel like you were kind of doing your bit to help move this on?
Yeah, definitely. When I walked out after having the first vaccination, I had a warm feeling inside to be doing something in these days where sometimes it can feel quite overwhelming.
How important has the willingness of trial participants been, Dr. Pankania, in getting this vaccine tested and approved?
Oh, it's very important. And when people say to us that this vaccine has appeared in record time, well, it has appeared in record time because all that bureaucracy, the funding, the ethical committee approvals, etc., was speeded up, not corners cut. And getting participants into trials is a big hurdle, a very big, very difficult, expensive hurdle. And because all that was eased at pace, we've been able to test it in large numbers across the globe, and hence we've got a result. And today we're deploying that vaccine.
And you mentioned there, Dr. Pankania, that it was about speeding up, not cutting corners. We spoke to a trial participant earlier who was very, very keen to stress how hard people were working on that trial. Is that something that you would echo in your experience, Josh?
Very much so. And, again, I want to reassure our listeners that we would never allow the cutting of corners just because we wanted to be first or speed something up. Because remember, we're giving these vaccines to otherwise fit and healthy people, and it is a long-term thing as well. Therefore, no corners cut. We've got to get it right. And that's why you will also have noticed that the MHRA took its time to diligently look at all the data very carefully before licensing it.
Absolutely. It's worth saying I'm still sending out postal swabs every week, still at this point. I've still got follow-up appointments continuing next year. So 15th of February is my next follow-up appointment, which will continue for safety follow-up at 182 days and then a year. So by the time a lot of people are getting this vaccine, actually there'll be many months or many years when you multiply out by all the participants of data available.
Some people might have reservations about getting it. What would you say to them, Josh?
There's a pretty fairly commonly known test in healthcare, which is the granny test, which is what would you do if this was your granny, if you have a patient in front of you. For my own grandparents, they were already decided that they were getting this vaccine, and I absolutely support that. I would happily have any of my family have any of the vaccines that have been approved.
Josh in Birmingham, thank you for speaking to us this morning. Let's bring in Alison in the Isle of Wight. I believe you've got a question, Alison.
Hi, yes. Just, I suppose, with your previous caller, Josh, he's now been vaccinated. Does that now make him safe so that if I hadn't been vaccinated, I could hug him? Because it strikes me that even though you have been vaccinated, you can still act as a carrier of the virus, and therefore we won't be able to come out of restrictions until the vast majority of people have received a vaccine.
What would you say to that, Dr. Pankania?
Yeah, I was, if you could see me, you will see that I'm nodding my head in a positive direction. What I was going to say is that the AstraZeneca-Oxford group looked at asymptomatic transmission post-immunization, and we found that the AstraZeneca-Oxford vaccine protects, and it's what's the word? It is better at preventing asymptomatic transmission post-immunization. And therefore, once a sufficient number of people have been immunized, you can almost say that, yes, we are protected because the vaccine is good at also not making you be asymptomatic transmitters of the infection post-vaccination.
It's a good point, though. Josh has had the vaccine. Imagine I was carrying the vaccine. I hug Josh. Josh then hugs you. Could he pass the virus from me to you, even though he's had it?
Well, no, it would be exactly that, unlikely or very unlikely, because the vaccine is protecting and it is also preventing what we call asymptomatic infection, which is then transmitted to other people. So there are benefits from being vaccinated, which is you are protected, but also you are less likely. I'm not saying it's zero. It is difficult at this early stage to say zero. So less likely, very less likely to also asymptomatically transmit because you've got a mild infection from despite being immunized.
Do you feel more confident about hugging Josh now, Alison?
No, I'm not, because all the warnings since the beginning have been not simply about someone who's infected passing it on with their own infection, but it's passing it on via touch and clothing and picking up things in supermarkets. So if I have the virus and I hug poor Josh, and then that's on his clothes, and then someone else hugs him, to me, that can still be passed on, even though Josh is completely free of it.
Valid concern?
Those are low risk issues. The bigger risks are direct person-to-person spread, i.e. a direct hit from one person to another. But the bottom line is we've got the vaccines. We still maintain our infection control guard. So the way I would like to describe it is we've had several layers of protection which protects you from infection, which is distancing, good ventilation, hand washing, mask wearing, and then add to this a very, very big, good extra layer of protection, which is the immunization, the vaccines. But putting all those measures together, you are well protected. But on their own, it isn't good enough. So we continue with all infection control measures and add one more to it, which is the vaccine.
Alison in the Isle of Wight, I hope that goes some way to answering your concerns. Thank you for your call this morning. Josh, just before we let you go, given that you have had the vaccine, I'm not for 1 second suggesting that you are in any way a reckless person, but has it given you a bit more confidence? Have you kind of been seeing people, or have you let your guard drop at all?
No, not at all. Christmas, I stayed in my own household, had some quizzes over Zoom with my family. Didn't see anyone outside the household. I think it's really important to say hands, face, space. So those same messages need to carry on while the population's being vaccinated. And certainly, if you can think, it would be very confusing for people if they did see people start to behave differently because they've been vaccinated. It's still relatively uncertain at this stage as well. It's a reduced risk, but not an absent risk. But I think it'd be very confusing public messaging. And I know that people have already complained that messaging across the past year has been confusing. So hands, face and space for me. And no, I'm not behaving any differently at all.
So stick to the rules, even though you've had the vaccine.
Absolutely.
Josh in Birmingham, thank you so much. And I'm sorry we turned that into an exercise in who could and should hug you. Let's bring in Kirsty in Surrey. Morning, Kirsty.
Morning.
And Clive in Southampton. Hi, Clive.
Hiya.
You both got questions. Kirsty, take it away.
So my 90-year-old granny went to get her Pfizer injection recently to find out that because she has a penicillin allergy, she wasn't allowed to have it. And I just wondered whether this new AstraZeneca one will allow those that have got allergies to the likes of penicillin, whether they'll be allowed to have it or not.
Doctor?
Yes. So when we started the immunization with the Pfizer-BioNTech vaccine, we had 2 people with severe allergies to many things who reacted badly to the vaccination. And as a result, immediately overnight, the data sheet was changed to say, do not give to people with extensive allergies. Okay, so that's the origin of our caller's concern and her grandmother not getting the vaccine. Now, with respect to the AstraZeneca-Oxford vaccine, again, it will be given out. We will be monitoring people. At this point in time, there is no indication that there will be a contraindication for people with allergies, such as the one described, not to receive the vaccine. So we always monitor, we always change if we have to. Right now, at this point in time, I do not see a contraindication to getting the new AstraZeneca-Oxford vaccine for your grandmother.
Good news for your granny then, Kirsty.
Yeah, absolutely. I just hope she gets the phone call soon.
Oh, fingers crossed. Well, sending our love to her and you. Clive, what was your question?
Yes, with this vaccine obviously going to start rolling out from Monday, which is fantastic news considering the year that we've had. What does it mean for, I'm 56, so what does it mean for obviously people my age? And will there be a situation that by next December, do you think we'll be able to sit down with family at Christmas? Do you think things will change by then? And without having to wear a mask?
That's a good question. To be in a good place, we will have to have immunized over 70% of the UK population. And if it is true that we have a very infectious strain of the SARS-CoV-2 virus in circulation, we would have to go beyond 80%, 85, even approaching 90% to get ahead of this infection that is spreading. So there is quite a lot of mileage to have. And if we look at the sums, if we are immunizing at 1 million per week, then that takes 50 weeks to immunize 50 million people if we get it right. That's still only one dose. And greatest protection is achieved by having 2 doses. So we are, to be truthful, some way away from being able to say that we've now seen the last of this pandemic. And one more thing, which is very, very important.
Will we be able to go on holiday in 2022, by the end of 2022? Do you think we'll be able to go abroad?
It's a difficult answer. It's a difficult one to answer because
possible?
it depends. Can you just wait, please? It depends on how the other countries are also immunizing their population. So if you are going to a country where there is poor coverage, poor uptake of the vaccines, then you are entering a territory where there will be quite a lot of the virus in circulation as well. And just because you've been immunized doesn't mean 100% of the people are protected. So the protection is at the order of about 90%, 95%, but definitely not 100%. So there are other conundrums that we must also consider. And a good public health measure is immunize in your country, immunize elsewhere as well. Then the world becomes a safer place.
But not every other country is going to have 100 million doses like the UK, is it?
And indeed, this is the big issue. So I do know that India will also be manufacturing the AstraZeneca-Oxford vaccine in their many, many billions of doses. But all this takes time. And I know that everyone is feeling constrained and they want to say by Easter things will be right. It does take time. It cannot be sorted by Easter. It's going to take many months to get on top of this. Not by spring. Definitely many more months before it gets better.
Well, Clive in Southampton, thank you for giving us it's probably what a lot of people are thinking. Does this vaccine mean it's over? We're looking ahead to what can we do next Christmas? What can we do, for our holidays? But doctor, given the amount of time it's going to take to get enough people vaccinated to get ahead of the disease, is there any concern this vaccine is going to give people a false sense of security?
Yes, it is very important to get our messages right. This is really important. And only this morning I was listening to our Matt Hancock, our Secretary of State for Health and Social Care, and he appeared to imply that we will be okay by spring. And I would like to say that's hopeful. It's not possible that we will have immunized sufficient numbers by spring for us to say things are much better. Of course, marginally, incrementally, things do start getting better, but I don't think that by spring we will be out of trouble with the pandemic.
Valerie in Bath asks, will people who are taking medication to suppress their immune systems be able to take this new vaccine?
Yes, indeed, Valerie. So I'm also a fellow resident of Bath, and I'm very happy to answer your question. There is no reason why people who are immune suppressed should not get this vaccine. These new vaccines, the Pfizer one, this Oxford AstraZeneca one, are different, and they can be given to people with suboptimal immune systems. It's not a problem at all.
And Peter in Harrogate says the Pfizer vaccine isn't allowed for people who have allergic reactions to food. Is this a general policy for any or all vaccines, or is it just this Pfizer vaccine specific?
It was a very specific thing with the Pfizer-BioNTech vaccine. We will be monitoring all the other vaccines out in the field as we start giving it out. But right now, at this point in time, if you ask me, can I have the AstraZeneca-Oxford vaccine because I have this or that allergy? I would say, yes, you can, but we will still be monitoring the situation just in case.
Dr. Bharat Pankania, thank you so much for taking the time out this morning and talking to us and talking our listeners through their so many questions. Thank you also for sharing what I can see is a gorgeous Christmas tree behind you there, still very in the festive spirit. 08085 909 693. That was Dr. Bharat
Doctor,
Pankania.
Thank you very much for your time today. Enjoy the rest of your day. Take care. Bye-bye.
If you've got any questions, if you want to ask anything about the new vaccine, then we'll have another doctor with us in a few minutes' time to answer anything